In my own experience as a GP for the last 20 odd years, it changed the way I approach patients. It made me less reliable on other services because I have nearly everything out of this Medicube on a regular basis.
Everybody's responsible for their own health, aren't they? But that's easier said than done sometimes, because depending on who you are, where you're born, what socioeconomic background you come from makes that easier or more difficult. So some of that's about education, some of that's about access and opportunity. Because we've got people within the building who are exercising and, some people very, very attuned to their health, when they're not feeling so good, it's really fantastic to have an option to be able to walk down to the clinical area of the building and say, please, can I go in the Medicube? And just to get those results, to see how they are.
You sit average 5, I've done it in around 5 minutes, and most people manage to do it within 5 minutes and give you an indicators about your health well-being, about your blood pressure, body mass index, about your heart rate, about the possibility of getting diabetes. There's a lot of predictive values in the Medicube that I found magnificent and does help clinicians on a daily basis. Whether you're a younger person, whether you're a busy, hard worker, whether you're middle-aged, fit and healthy, and even if you are an older person, 5 minutes, it will give you a lot of answers about yourself which you might not be aware of. And that will give you a platform to seek the appropriate health and advice and subsequent management. So definitely worth investing in. I've got one of my patients, I call her regular. She's a healthy lifestyle-oriented individual, and she uses it as a platform to cut down her overall cardiovascular risk, which we were able to calculate based on her lived experience in the Medicube. And every 3 months she's been attending to calculate her risk factors, and you can see visibly how her risk assessment dropped from a lower grade to actually normal level over the last 9 months. There was another client, and part of the Medicube where they do the 2-lead ECG, which is the heart trace, we picked up atrial fibrillation. She wasn't aware of it, and that's life-saving because she was just about to go on a trip, and of course that could have created a lot of unwanted complications. And that 5 minutes stay in the Medicube managed to pick up a heart irregularity, and we managed to confirm the atrial fibrillation. She's on the correct treatment before her trip. And I think that's a motivator. And if you're into your health and being fit and healthy, and there is no need to wait for the illness to occur before seeking advice, this is the perfect answer. It can monitor a lot of vitals on a regular basis and give you better direction in life.
There are people who are using the Medicube specifically to track their progress. So they know they've got a baseline of health, and then they go off and they start their program of physical activity. We know lots of people doing Pilates are doing this, and then regularly go in the Medicube to chart their progress, which is really exciting, because you could argue that they're converted already because they're already doing that exercise, but there's the potential there to use that to inform other groups as well, and to create pleasure in the fact that people's health has benefited from activity, and they can measure that very tangibly. There's the opportunity to spot potential disease and address it before it gets to a level that is the point of no return, I suppose. So we want to be able to treat people and to be able to advise them how to change their lifestyles so that they can live for as long as possible and have the best life possible, really. If people don't understand what the opportunities are to improve their own health, it's our job and our responsibility to ensure that we help them to achieve that. And people respond to short, sharp messages, don't they? And that's why we say it's a 5-minute investment in your health. And I'm really glad we've got it.